high blood pressure, high cholesterol, and high sugar levels, as demonstrated by diabetes, are the primary causes of heart disease, but they're also the primary risk factors for heart disease. Of course, there are things that are non-modifiable risk factors, including age, but these three things are actually modifiable risk factors, what we call traditional risk factors. There are things that are less traditional, and we're starting to learn about them more: inflammation, and other things that may also modify both the risk factors themselves, modify the diabetes, high blood pressure, but also modify your risk of heart disease. My name is Sadeer Al-Kindi. I'm a cardiologist. I specialize in prevention of cardiovascular disease and imaging of cardiovascular disease. Heart disease has been linked primarily with a lot of environmental pollutants, but one of the major pollutant or toxicant that we've been studying for decades now is air pollution. And air pollution is probably the most important environmental risk factor. It's estimated to cause anywhere between 4 to 6 million deaths annually in the world. So it has been shown to increase risk of diabetes. It has been shown to increase risk of high blood pressure. It has been shown to increase risk of obesity as well to a certain degree. And all of these factors have been shown to increase risk of heart disease. So by maintaining a healthy environment, whether it's just having access to good food environment and good social environment, these things may lead to improvement in heart health. Air pollution is an umbrella term that we use for a variety of different compositions that affect human health through multiple mechanisms. And amongst that, we measure something called particulate matter. These are really tiny particles that fly through the air and get inhaled through the lungs. Air pollution has been shown to increase blood pressure. Air pollution has been shown to impair glucose tolerance as measured by insulin sensitivity, and that could lead to diabetes. And air pollution has been also associated with risk of obesity and other things. So it turns out that both heat and cold can actually impact the cardiovascular system. And if you think about it, there is an adaptation. The cardiovascular system has an adaptation system to help us conserve energy and lose energy when we need it the most. In hot environments, in order for you to maintain that blood flow, you need an increase in what we call a cardiac output or the circulation. And if the heart has a pre-existing condition that makes it harder for it to maintain these increased energy needs, then it can get into trouble. The same thing can go around for the cold temperature, where the body is trying to conserve energy. So it constricts these small blood vessels close to the skin, and what it leads to is increased resistance to the heart. So if the heart is impaired, it may, in theory, can go into trouble because it's not able to maintain pressure against high pressure and high resistance.